Hi, my name is Ben, and today we're going to talk about how to diagnose hip pain. How to diagnose hip pain will be the question that comes to your mind immediately when you started feeling pain in your hip. The hip and pelvis territory of the body is extremely unpredictable, with bunches of joints, muscles, and delicate tissues meeting and cooperating to help the body. A side effect with hip agony regularly requires the assistance of a specialist to figure out what's making the torment and how best to treat it. Conceivable reasons for hip agony could be osteoarthritis, bursitis, damage to the muscles, ligaments or tendons, or different choices. So how does your doctor reach a diagnosis? How to diagnose hip pain by your doctor? He or she will likely rely on three primary means of evaluation: personal history, physical exam, and imaging or lab tests. Your doctor will get some information about your family ancestry, just as therapeutic history, as well as past issues with hip agony or procedures on when it comes to how to diagnose hip pain. For instance, a nearby relative with hip osteoarthritis could show you that you have it as well, since around half of hazard of hip osteoarthritis is inherited. Likewise, past hip damage can raise a chance for future osteoarthritis. Knowing exactly where the pain is located, what type of pain, and when it occurs can tell your doctor a lot about the likely cause of how to diagnose hip pain. Hip bursitis frequently causes agony and tenderness outwardly towards the hip. Osteoarthritis torment will in general be terrible after times of latency, for example, remaining in quite a while, sitting or getting up in the first part of the day. Likewise, your doctor may palpate, contact your hip and request that you move it in specific courses, for example, remaining on one leg, to limit the outcomes and get the fact he needed to how to diagnose hip pain for his patients. Even though your doctor may likely analyze your hip torment without the use of imaging or lab tests, they are a useful device when achieving finding if your history or physical tests are uncertain. An X-ray can uncover the state of the bones or joints in the hip, demonstrating lost space or development of bone spurs, the two of which show osteoarthritis and therefore can help diagnose hip pain. In any case, X-rays don't uncover insights regarding delicate tissue like ligaments, muscles, or bursa like an MRI scan can, so your specialist may arrange to do this rather than an X-ray. Also, your doctor or specialist might need to take an example of the fluid in the hip to lead to lab tests. This is known as joint desire or arthrocentesis. In addition to the fact, this allows the specialist to test the liquid for contaminations or demonstrative hints. However, it might help reduce the torment brought on by swelling in the joint. Once your doctor understands what's causing the pain in your hip, he or she in question will be all around prepared to offer you alternatives about ideal approach to treating the agony. How to reduce hip pain will not be difficult. HealthMate Forever is the leading manufacturer and seller of TENS units and PMS units on Amazon. Now, they offer a wide variety of different products and pain relief options that you may want to check out. As I discussed, these are just a few different options that you have available to you. If you have any questions, comments, or concerns, please comment below. And if you'd like additional information on anything we talked about, check out the links, and thank you for watching.